Embryo transfer, fact or fiction? Important things to know prior to your embryo transfer. I am Dr. Sneha Sathe. I'm a fertility doctor. I'm a consultant and clinical director at Nova IVF Fertility in Chembur and in Vashi. Being a fertility doctor, I'm asked every day by my patients undergoing embryo transfer about the things they need to do and the things that they should avoid. So one question that I'm asked most often is, doctor, do I need bed rest after the embryo transfer? So at no point after your embryo transfer do you need bed rest, neither immediately after the embryo transfer or during the 2-week wait. So there was actually a study done in which after embryo transfer, a group of women were advised to take bed rest and the other group of women were asked to immediately get up and empty their bladder and ambulate. So in this study, they found that the pregnancy rates were actually better in the women who started ambulating or walking around immediately after their embryo transfer. The other thing is that bed rest, generally speaking, is not good physically for your health and even mentally for your health. So bed rest is something that I tell my patients you should avoid completely. Avoid taking bed rest after the embryo transfer. So embryo transfer is a procedure which we usually do with a partially full bladder. It is an uncomfortable situation to have your bladder full, go through an embryo transfer and then take bed rest for another couple of minutes or an hour for your bladder to get more full. So having a full bladder itself is discomforting, and after the embryo transfer, hence it is advised that you should get up and go and pass urine. You can carry on with your daily routine activity, you can continue going to work, you can do your household chores, but you should not do something that you're not used to. Don't do any heavy or high intense workouts. Don't go for any unplanned travel or long distance travel. Don't take on, if you're a working woman, don't take on any additional projects which will make you, travel out of station or make you have very stressful days in and days out. The next question I'm often asked is, if I cough or if I sneeze, will my embryo fall out? So this does not happen. The walls of the uterus are opposed to each other. We place the embryo inside the uterus. The uterus is a potential cavity. It's not like this. There is no space inside. The walls are almost like they're stuck to each other. So nothing that you do is going to make your embryo fall out of your uterus. You need not worry about that at all. The other question that I'm asked very often is, can the couple have sexual intercourse after the embryo transfer? So theoretically speaking, sexual intercourse should not be a problem. But these are high stakes. I mean, this is something that you're going through physically, mentally, financially. And to reduce any risk of having a negative pregnancy test or reduce any risk of having a miscarriage, I usually advise couples to avoid sexual intercourse after the embryo transfer till the pregnancy test. And then depending on the pregnancy test results, we can discuss the scenario again. Another question that is often asked to me is what food to eat, what food to avoid. So here again, there are no hard and fast rules. You should continue eating what you eat on a daily routine. Avoid changing your diet, avoid eating out. Now, avoid eating out, the idea is that, you avoid eating roadside food, avoid having a stomach upset or food poisoning during this period. You need to avoid packaged processed foods. These are not going to have an impact on your embryo transfer results or pregnancy chances. But processed foods, especially when you're trying to conceive, is not a good idea. So whatever you cook at home, your healthy home-cooked food, everything in moderation is absolutely fine. Most important is to eat at regular intervals and to keep yourself well hydrated, particularly if you've had a fresh embryo transfer. What about the sleeping position, doctor? So you might find it strange, but women do ask me if they can sleep on their stomach, whether they need to sleep sitting up, or whether they can sleep on the bed or they need to sleep on the floor. So it really doesn't matter how you sleep or which position you sleep, whether you sleep on the bed or you sleep on the floor, you can sleep in any position that is comfortable for you. Another question that I'm often asked is, can they use an Indian toilet? And of course, you can continue using the Indian toilet. It is not going to have a negative impact on your pregnancy results. So the embryo transfer procedure, the procedure itself is actually a very simple procedure. It does not require anesthesia. We do it with a partially full bladder and we use an ultrasonography machine to help guide the procedure and to help decide where to deposit the embryos. What I usually advise my patients after the embryo transfer is to get up, pass urine, be comfortable, change their clothes. The nurse will go through their medicine list one more time to explain how to take the medicines and when to take the medicines. And what is important, what I tell my patients after the embryo transfer is that they have to avoid bed rest, but they should avoid long distance travel, they should avoid intercourse, they should avoid eating out. So eat home cooked healthy food, continue working if you're a working woman, and continue your daily household activities as you normally would. Most important is, do not miss your medicines. Take medicines exactly the way that they have been advised to you and come for the pregnancy test as has been told to you. Usually if it's a blastocyst transfer, we'll call you for the pregnancy test, the beta HCG test, about 10 days after the embryo transfer. And of course, with all good wishes from the doctor and from our nursing staff, we'll tell you goodbye and come back soon.